let me tell you a little bit about St. John, New Brunswick. If you pass 5th grade geography, you probably know that New Brunswick is what we call a have-not province. So what does being a have-not province have to do with healthcare anyway? Well, quite a bit actually. As we know, healthcare is a publicly funded resource. So when it comes to healthcare, and specifically prenatal care, being a have-not province means less. There are services and prenatal systems all over Canada that we just don't have access to here in St. John. Services like midwives and services like doulas are only available privately. And when it comes to perinatal mental health services, it's really challenging to access them. Here, prenatal care is covered almost exclusively by family doctors and by specialists. Now, if we can demonstrate that despite all of this, everybody's getting good prenatal care, then we should be fine. But there is not one single investigative report into the status of prenatal care here. So how do we know needs are being met at all? We don't. St. John has reported time and time again that income and education are major sources of health inequity here. When we look at the context of prenatal care, young age also factors into that equation. So for my thesis, I put together a study consisting of an online survey and one-on-one interviews to investigate how low income, less education, and young age related to prenatal care experiences as they pertain to marginalization, access, and satisfaction with care. So, how did it all shake out? Well, people are pretty satisfied with their care, but there's definitely gaps. Most people in the study had a prenatal care provider they were able to access, but they weren't always able to get to their appointments because of things like hidden costs, like parking, or sometimes they couldn't access a service because they were never told about it. There were services people felt would have improved their care, like midwives, but it just wasn't available. There was also a substantial amount of people who said they had issues with mental illness, 29%, but not everybody had it addressed as part of their prenatal care. Importantly, a lot of people found they did experience marginalization. And when we took a deep look into marginalization, it looked like having their concerns dismissed, being stigmatized, and being judged. Finally, participants found that they were very deeply affected by their birth experiences and not always in a good way, to such a point that it totally colored their entire perinatal experience. This was linked to the fact that there was some extremely marginalizing behaviors happening on the main labor and delivery unit, which is the only place of where to give birth in St. John. So what do we do with all of this? Well, going forward, it's going to be really important to address the gaps in mental health services for pregnant people and figure out exactly why there's such an ingrained culture of marginalization on labor and delivery units, because this is not something that's specific to St. John. Research has shown that this is an issue that's pervasive everywhere. But realizing that good access goes beyond just getting in to be able to see a doctor, and helping healthcare professionals identify and reduce marginalizing practices are a few really important ways we can improve prenatal care in St. John. Thank you.